Well, good morning to all of you, and what a pleasure and a privilege it is for me to have a few minutes to share some thoughts with you. And I talked to Allison earlier and Tom and Bob, and they originally said, would you come and talk a little bit about the high-level meeting of the UN? But then they said, you know, it might be a good idea to talk a little bit about some other things. So I thought I would begin this morning by just asking you to be contemplative about how your world and our world together relative to cancer is different today than it was a year ago. We have the Affordable Care Act. Won't be fully implemented until 2014, but just think about the fact that in your life and in your career, until last year, if you got breast cancer, they could take your health insurance away from you, called rescissions. Or if you'd already had cancer, as my wife has, you can't get health insurance. You can now, no pre-existing conditions. And there's 2.3 million young adults who have health insurance coverage with their parents who are covered today that weren't a year ago. So we have new platforms that we worked and persuaded hard to get to, but those are not just platforms, they're opportunities for us to build those out further. The Affordable Care Act. We also have, for the first time in the history of the Republic, a nationwide prevention plan. And I was appointed by President Obama to this I wrote it down, I got it right, but I called my office, I said, this surely can't be right, but it's the National Advisory Group on Prevention, Health Promotion, and Integrative and Public Health. That's the official title. The bottom line is we met this past week, and I would say the committee chaired by Jeff Levy would honor as a single member, this request. Sea Change is in a great place to help us get it right. So we've got a national prevention plan, and we've never had one before, but we've got to implement it. We've got to get it out there and get it up and running as soon as we can. What a wonderful area for Sea Change to insinuate itself into, given the fact that you have all three sectors around the table. And then I had the privilege of being a part of the official delegation to the first ever UN high-level meeting on NCDs, non-communicable diseases. And so let me just give some reviews. Some of you are well aware of this, others of you may not be. There have been 28 high-level meetings of the UN since the end of World War II. A high-level meeting, by definition, these are all terms of phrase in UN parlance. It means every head of state is invited and expected to be there, and they're not authorized to send a substitute if they can't be there unless that substitute is prepared and capable to make a decision. So there have been 28 high-level meetings since the end of World War II. Only one ever dealt with a health issue, and that was HIV/AIDS in 2001. It, of course, changed the world. So we just had the second high-level meeting dealing with the health issue, and that obviously was on non-communicable diseases. This was a long time coming, hard work for over 3 years. There was a ministerial meeting in Moscow that I attended that preceded it a few months earlier. But the bottom line, I believe this will turn out to have been an historic meeting. It had 34 heads of state, over 100 health ministers, and over 120 member parties or countries represented. More countries, more heads of state, more ministers of health than attended the high-level meeting in 2001 for HIV and AIDS. Important point. So what happened? Well, they passed a political declaration, as it's called, 13 pages long. I'm happy to do what I can to get you a copy. They have a link, and the link, I've written it down, but it's that long and it's not active yet. But I happen to have a copy, so I'm happy to share it. But what does it say? It says 4 important things. It says in 13 pages, NCDs, non-communicable diseases, will be the health, disease, and disability challenge of the 21st century. I repeat, when you read it, it doesn't say it quite the way I'm saying it, but that's the net takeaway. NCDs, including cancer as perhaps the centerpiece, will be the health, disease, and disability challenge of the 21st century. We may have an influenza epidemic in 2018, we may have a bird flu, but nothing will trump the importance of NCDs to this world we live in the 21st century. Second, it couples inextricably the notion of NCDs and economic development. It couples inextricably. It'll never be separated again. The tie between doing something about non-communicable diseases, including cancer, and economic development. We help support two important economic studies, one by the World Economic Forum, the other one by the World Health Organization. David Bloom at Harvard, distinguished professor, did a lot of work. If we don't intervene, if we sit on our hands and watch, over the next 2 decades, from 2010 to 2030, the lost economic output in the world will be $47 trillion. I'm not talking about the cost of treating NCDs. I'm talking about the lost economic output. Now, many of you may be like me. I have no idea how much money $47 trillion is. But I'll give you a sense of it. It's 75% of the global GDP in 2010. Or another way of looking at it, it is enough money to eliminate $2 a day poverty in the world, which afflicts 2.5 billion of Earth's inhabitants for a century. So a lot's at stake. Another way of putting it is simply these emerging economies will hit a wall when NCDs continue to grow, and just as they're emerging as a viable economy, they will be hit with this enormous, enormous problem. The third point is terribly important because it wasn't there. I remember going in, Matt, for the National Interagency Council meetings in New York City in the 1980s, and cab drivers saying, what about this mysterious disease that they're talking about here in New York and so forth? Well, this high-level meeting in the 13-page political declaration talked about what we need to do. Again, be contemplative about where we are today, what platforms we have, what knowledge we have, what could we do if we decide to leverage our assets and take action. And so in this political declaration are what they call best buys. Best buys, which here are the things that we could do to intervene and indeed be highly cost effective. A point I would like for you to remember. Analyses were done, and all of those things recommended in the political declaration that need to be done, and I'll comment on a few of those that relate particularly to cancer, but I won't have an exhaustive list, can be implemented all around the world for $1 to $3 per person per year. 47 trillion, $1 in developing countries, $3 in Western developed countries per person per year, best buy. So we know what we need to do. And fourth, we can't do it unless there's an intersectoral cooperative collaboration. Does that ring with anybody in this room? We will not solve the cancer problem, we will not solve the NCD problem by the government working alone. Won't happen. It will not happen by the private sector working alone. It won't happen by the NGO sector working alone. It will happen, can happen, could happen if we can find better ways of working together, public-private partnerships and collaborations. And the last point I'll make before commenting on some comments I was privileged to be able to make in my presentation to roundtable number 2 is that this resolution, and just think about it as you turn on the TV and listen to the UN and all the debates, this passed unanimously. So now we have an official statement by the UN with the most participation of any health-related high-level meeting and a unanimous vote that this is the way we need to go. That's another tool, another platform for us, whether it's the Affordable Care Act, a national prevention plan, or a resolution or a political declaration by the UN, something to use to make sure we get cancer and other NCDs on the health agenda. I made the point in this meeting, which of course obviously was predominantly government agencies, the 120 plus member parties, the ministers of health, et cetera, but another interesting little tidbit, there were over 250 NGO representatives allowed to attend and participate. Unprecedented, it's never happened before. There were more than 250 because I wasn't counted because I was a part of the official delegation, but there were 250 other representatives of NGO who participated. And my comment when I testified was to begin by saying the following. If we knew here in this room when and where the next tsunami would hit, that would not take just hundreds of thousands but millions of lives, if we knew when and where that would happen, wouldn't we be morally bound to bell the cat, to inform, and to take action, to mitigate that loss of life or to reduce human suffering? And I think, of course, the answer is yes. My point there was there is a tsunami of NCDs coming. And it's not just in the Western world, it is globally. And there is not just now a given public health expert or a scientist saying that, but it's an official political declaration of the UN. And so if that's true, isn't it incumbent upon us, isn't it a moral imperative for us to intercede? I believe that it is. So we have to get much, much more serious about taking advantage of the platforms we have now that didn't exist before. There's some of us probably here that thought 5 years ago, when I went to my board, as Bill and Gary Reedy know, talked about entering the fray about health care reform, at which time it had no political salience. It was almost a pipe dream. And it wasn't pretty to watch, but in reality we have something now that some of us thought we might never have, or at least not in our careers or lifetimes. Okay, so I concluded by saying the following, because I think I would throw it out to you today to provoke your thinking about the role of sea change moving forward, not just domestically, but if indeed it can be involved in helping on a global scale. I made the point that no one sector can solve this problem, but I honestly believe that the NGO sector has a key role to play. That is to say, it can empower the private and especially the public sector in ways neither of those can do themselves. And I call it the ABCs. What can we do that they can't do? One, we can advocate strongly and without measure and not be conflicted. So as I said to them, many of our organizations want to do anything and everything we can to help the person facing cancer, and when we eliminate the problem, goodbye, we're out of business. We don't have to return a dividend to an investor. We simply want to do what is right. The second thing we can do is build capacity. My own organization has a lot of experience with that, not only domestically, but globally. We'll have the Relay for Life in 24 countries this next year. We've had the opportunity to give seed grants that help establish the Framework Convention Alliance. And so we've got activist groups all around the world in developing countries that otherwise couldn't exist. So we can build capacity. And thirdly, we can collaborate. We aren't the government, and therefore we don't have lots of laws and regulations governing us. We can, as long as it's legal and ethical, reinvent ourselves whenever we want and learn how to work with the private sector and how to work with the governmental sector in meaningful ways. Well, let me just, because I know we want to have some dialogue and wrap up here, I just am very excited that we have opportunities that many of our predecessors, and Matt's here, Matt Myers, I'm not saying this is a panacea, it is not. There are many people that were concerned and expressed opinions. There are no targets and there's no money. Both of those were in the political declaration in 2001 for HIV/AIDS, but we're in a very different economic time. So I'm not saying this is perfect, far from it, but it is something we have that we didn't have before. It's a tool, it's a platform that we can use, and I'm confident that we will get targets. In fact, there is a directive that WHO has to work with member parties to come up with targets and goals and metrics by the end of 2012, and there's a call for a follow-up meeting to look at progress by 2014. So I'm very optimistic, even though it is an imperfect document. Let me just say one more thing, and Carolyn Clancy might want to comment on some of these things that I've said. But I understand yesterday, and I'm sorry I couldn't be here in person, there was some issue about, well, prevention doesn't pay or isn't economically necessarily desirable. I just want to make the point that in all probability in the next 24 to 36 months, the American Cancer Society will announce the first ever 20% reduction in age-standardized cancer mortality rates in America, and it's never happened anywhere else in the world before. And I'm estimating that on the basis that for 17 years they've gone down, and we've measured that, and that's one of the reasons that we now say that the American Cancer Society is the official sponsor of birthdays, because we know about 900,000 people will have a birthday this year that wouldn't have had if the death rates had stayed the same as they were in 1991. When that 20% happens, one of the points I want our communications people to get out there is that 20% reduction, Bill Todd, is a $10 trillion value to the American people, published in the economics literatures by two distinguished professors at the University of Chicago. So make no mistake about it, the investment in health care that was purposely kept under $1 trillion, in my opinion, if properly built out and implemented, will be a tremendous payoff over time for the American public. So with that, let me, I didn't mention, excuse me, I wanted to mention some of the specific things about cancer, and then I'd be happy to take any questions or engage in dialogue with you. Some of the kinds of, and it's interesting to happen, and Matt knows from Latin America came out with a resolution, and all of a sudden, the next time it appears, they've cut everything out that we got in, and then we go to Moscow and put things in, and then by the time it gets cut out again, it's tough to get specific reference to any specific disease, but just to give you some sense, and this is important, I think extremely important. It renews political commitment to accelerating FCTC implementation. Just a reminder, the Framework Convention on Tobacco Control, first ever public health treaty in the history of the world, is replete with protocols that, if implemented, have been proven to work wherever they've been tried. It specifically, for example, not only talks about implementing the FCTC, it talks about, which was a coup, increasing excise tax on tobacco. You can imagine to be unanimously passed, that was a stretch. It recognizes the importance of reducing tobacco consumption. It acknowledges the importance of taxation. It commits governments to increasing access to affordable, safe, effective, and quality-assured medicines, and to improving access to palliative and rehabilitative services, particularly at the community level. So for us, cancer is not only mentioned many times, but it's the continuum from primary prevention. It mentions screening, it mentions vaccines. So we've got many, if not all, most of the things that we would care most about specifically referred to in the political declaration. And political declaration itself means something important, but to give you some indication of how politics play, the one word that they wouldn't allow us to put in is the word epidemic, which of course it will be a pandemic. It'll be an epidemic in every major region of the world. But the reason that epidemic couldn't be used is because that term can be used legally to do certain things with respect to patented drugs that wasn't politically acceptable. So with that, I'll conclude simply saying I believe that as we move forward, and as members, and certainly as the Board of Directors moves forward, we should think big about our agenda and how we insinuate ourselves into this movement, because we have opportunities to have an impact on NCDs and cancer in particular that we simply have only been able to dream about heretofore. Thank you very much.